I think when you mention sleep disorder, if in short, it just means it's actually any disorder that results in sleeping. So it can be lack of sleep, it can be too much sleep, it can be, you have too much sleep as well. And then it can be actually problems associated during sleep, like sleep apnea. I'm quite sure of that. That means you stop breathing while you're sleeping. It has happened to quite a lot recently. So this whole gamut of problems associated with sleep are called sleep disorders. But of course, the most common that we are facing a lot is actually insomnia, or the lack of sleep. In a Chinese medicine perspective, your heart governs your mind. Interesting, not your brain governs. So actually, so that's why Chinese got this called 用心去想, not 用脑去想. So in essence, it believed that your heart actually on the meridian, if it's flowing smoothly, it will governs your mind and hence put you on sleep. So a lack of energy or excessive energy in the heart meridian will then result in sleep problem. And that's how we explain in TCM terms why older fogies have more sleep problem, because of the reduction in energy, what we call qi, in the heart meridian. And hence the flow of the heart meridian towards the body is then deficient and is unable to calm down the mind, and hence there is a difficulty sleeping. In a normal yin and yang cycle, our body lapses from yang to yin in the morning, so between 11 to 1, and you lapse from yin to yang at night between 11 p.m. to 1 p.m. And during this interface, you are supposed to rest through to actually transit that. So just to share with you, that's why you realize in Chinese, a lot of them take naps, because then they transit and they feel much better after that. And at night between 11 to 1, if you realize, if you feel tired at 11-ish to 12, if you drag on and don't sleep, and if you cross 1 or 1+, you actually become very awake already. And that's why we call this transition. So in the natural yin and yang cycle, that dictates your biological hormonal clock, and that dictates your sleeping pattern. So this is how the TCM look at sleep in these two manners. In Western medicine, of course, there are that many factors that actually cause sleep that we actually can think of. The most common would be stress, anxiety, medications, even lifestyle, disease as well. We know that certain disease actually make you more difficult to sleep, and activities. So I think very clearly when we look at Western medicine, the most common will be actually stress, and actually some medications. But some people actually take something which they didn't know, and that actually results in hyperactivities, and then that's why they can't sleep. Of course, the other activities like change of timing due to traveling, or due to even time zones, that will also disrupt your body clock, and that will then cause you to have a problem in adapting to the body clock cycle, and hence you actually have difficulty falling asleep.